Hello, good afternoon, everyone. My name is Elaine De La Cruz. You can call me Al for short. And I will be your speaker for today on your Mental Health Day. It is my honor and my privilege to share my knowledge about mental health and mental disorder. I am currently working as as an advanced practice nurse in one of the state-owned psychiatric hospital here in Phoenix, Arizona. And I worked in an admission unit, so I am also happy to share my knowledge and information about COVID-19 because we are actually screening everybody for COVID-19. So I kind of have some knowledge about COVID-19 disease as well. And our topic for today is nursing implications of COVID-19 for mental health. Let's start off with our objectives. At the end of the presentation, the audience will be able to first define COVID-19. Second, identify the effects of COVID-19 pandemic to mental health. And third, understand the nursing implications of COVID-19 to mental health. So what is a COVID-19? So the scientific name of the new coronavirus is called SARS-CoV-2. It stands for severe acute respiratory syndrome, coronavirus 2. It is actually a successor of the SARS-CoV-1, which caused the 2002 to 2004 SARS outbreak. I'm not sure if you are familiar with that. And it is believed that it has zoonotic origin. The scientists believe that it has similar genes or genetic similarities with that of bat coronaviruses. All right, but in people, the disease the caused by the virus is called coronavirus disease 2019, better known as COVID-19. And per CDC, older adults and those with chronic illnesses, such as those with heart problems or lung diseases or even diabetes. These are the people that are highly susceptible in getting severe or experiencing severe complications with COVID-19 illness. All right. So, what is mental health? Well, according to the World Health Organization, mental health is a state of well being, a state of well being upon which the individual recognizes his or her abilities, um, able to cope with the um, normal everyday stresses in life, can work productively and fruitfully, and uh, able to contribute to his or her community. Um, in my line of work as a psychiatric nurse, I always encourage my patients to use their coping skills. Please use your coping skills whenever they are angry or upset. All right, so we talk about coping skills. What are coping skills? or what is a coping skill? Coping skills are also known as coping mechanisms or coping strategies. These are tools and techniques that we could use to handle, um, emotions, difficult emotions, and decrease stress. All right, and per CDC, excuse me, COVID-19 pandemic has had made an impact in our lives. And social distancing is necessary to reduce the spread of COVID-19, but it also make us lonely sometimes and could actually trigger anxiety and depression. Okay, the COVID-19 pandemic, I mean. So, on this slide, what picture do you see? What picture do you see? We are seeing marbles, right? So, what is the significance of a marble? The symbolism of a marble, or a marble, symbolizes strength of self control and the mastery of thoughts. You know, and those are the virtues that we really need to cope with stress. All right. According to Mayo Clinic .com on their website, they suggested some ways to cope with um, with stress. On our facility, we actually encourage our patients to, use coping skills such as deep breathing or a relaxation techniques, and even crying. We encourage them to cry because it's a good way to release that pent up emotions. And some other would paint or do some coloring, which is good if that is their if that's how they cope with stress, then be it. All right, so Mayo Clinic had suggested the following to cope um, to cope with stress. The first one is take breaks from news. All right, we know for a fact that when we watch or hear the news currently, it's mostly all about COVID-19 pandemic. The we hear about mortality and the morbidity of the COVID-19 pandemic has brought us. So they suggest that taking a break from watching the news could lessen the stress. Yeah, for me, I feel it's very depressing to watch all the news. You could see the deaths and uh, and all that. So I try to avoid, not really avoid, but to lessen watching the news right now. And then we have to take care of our body as well. We need to exercise. We need to do some physical activities. We also need to get enough sleep. They recommend at least 7 to 8 hours up at night or per night, and also eat healthy foods. All right, and then avoid alcohol, avoid drugs, and please do not smoke. Because I mean, for those that are religious, you know, we believe that. our body is the temple of the Holy Spirit, and we need to keep it as pure as possible. All right. And then make time to unwind. Make time to unwind. And, if there is something that you really want to do, I think this is the best time to do it on your free time or during lockdown, during quarantine. When we had a lockdown last year, I think in June last year, here in Phoenix, Arizona, I really have that passion to dance. So I kind of like took that chance, that opportunity to, you know, um, do some dance videos during lockdown. And I tried to save it initially in my computer and my iPhone, but I decided to just send it to my friends just for fun. And some of them had posted it on Facebook, and people have kind of liked it to the point that I decided to take a certification on dance fitness and hip hop aerobics. So I'm also a Zumba instructor. um, I did some classes before, but uh, ever since we opened up the state of, I mean the state of Arizona had opened up after the month long lockdown. I kind of got busy, so I held that for a while. Um, let's see. So, and also Mayo Clinics suggested to connect with others, to be able to cope with, the stress, anxiety, or depression brought about by the COVID-19 pandemic. Connecting with others, it means our family and friends that are not within our household. All right. And there are a lot of ways to connect with our family and friends outside our household. You could email, you could Skype, you could even just call them, and even use social media. All right. And it is very important for us to connect with other people, because I always say that we need to practice social distancing but not social isolation, because we need some interaction, one way or the other. And also we need to connect with our community or faith-based groups, and as for me, I am a what you call this a an officer of a local nursing organization here in Phoenix, Arizona. It's called FANOGS. It stands for Filipino American Nursing Organization of the Grand Canyon State. And it's like the PNA, or the Philippine Nurses Association in the Philippines, where we have a lot of fun activities. Actually, as a matter of fact, I initiated a fundraising event last month. It's a pre-Valentine. We call it pre-Valentine Zumba for a cause. Um, we did some Zumba via Zoom, so we call it Zumba, and because we are trying to raise funds for our medical missions next year in the Philippines, in La Union, January 2022. And so we invite our families, our friends, and our coworkers to join us with an hour of Zumba. And our target funds was only at $700, but we were so happy that we were able to come up with a total of $2,500. And it's we were so overwhelmed that it really touched our hearts, and we were so thankful and gratified with people helping us out. All right. And speaking of connecting with community, um, I'll show you some of the pictures that we have. Um, just okay, just to have a little break from our presentation right now. These are my colleagues in the nursing organization that I am in, and we are also the dancers. So I was the leading or the lead dancer, and we are all nurses, as you could see. And at this point with the COVID-19 pandemic, healthcare professionals are considered as frontliners. All right, and we need to have fun once in a while or during our free time. In that way, we won't um, worry about the stress at work, and we will have a healthy coping mechanisms. All right. And let's see, there's more. All right. There's more. Connecting with the community, it's fun actually to do some outreach program, community outreach program, and you don't have to do it in person or face to face interaction. You could do it via Zoom or what other mediums that you could do. And we wear masks and we practice social distancing. And these are just for pictures. So um, yeah, it's good and it's fun. It's really great that you have that joy. I would say really joy, that feeling of joy when you help out or um, reach out to your community, give back when you give back to your community. All right. So moving on, let's discuss anxiety and depression on this slide. The COVID-19 pandemic has really, uh, as I've said earlier, had made a major impact in our lives, and we experience sadness, we experience stress, we experience fear, we experience loneliness, and even uh, anxiety disorder and depression, mental disorders such as anxiety and depression can be triggered. All right, and speaking of anxiety disorder, so what is anxiety anyway? um, C- Per CDC, or this Center for Disease Control and Prevention, they define anxiety as excessive worry. Excessive worry, it is characterized by excessive worrying that is difficult to control, and is associated with physical symptoms. We worry sometimes. It's okay, it's normal, but if you have that excessive worry to the point that you are already manifesting physical symptoms such as irritability, mood swings, or maybe lack of sleep, or even loss of appetite, then you may have anxiety disorder. And there is actually a research study done on the psychological impact of COVID-19 pandemic in the Philippines. That was last year. I think at the start of pandemic, I think it was in June 2020, and the respondents were like almost 1,900. And do you know that 25% of of those respondents um, said that they have moderate to severe anxiety caused by the COVID-19 pandemic. All right. So, how about depression? Depression, on the other hand, is that prolonged sadness. Um, Sometimes we feel down, and we we experience being in a bad mood once in a while, which is okay. But depression is really having that sad mood for a long time, and it even affects your normal day-to-day functioning. All right. And do you know that the Department of Health in the Philippines had said that at the start of the COVID-19 pandemic, they have an increase in this suicide-related calls in their crisis hotline. All right. Okay. So we will talk in detail um, um, beginning or on the succeeding slides. We will talk about the factors, measures, science and symptoms management, global health context of depression and anxiety. And we will also talk about some research done in the Philippines. This is related to COVID-19 pandemic and its relation to mental illness or mental disorder. So, what are the factors or risk factors, or we should say determinants, um, for anxiety and depression? The first one is trauma, whatever it is, whatever a kind of abuse um, a person experience, be it physical, emotional, even sexual abuse. Um, these people will have a great chance to experience anxiety and depression later in life. All right, and then we also have a stress. Um, we get stress once in a while. Um, it's still normal, but it's the stress buildup. It's a stress buildup. Like I'm gonna give myself an example. Just a week ago, my aunt passed away. Okay, in the Philippines. She's like my second mom, so I was really devastated. I was sad, and that's why I have to file a bereavement um, leave at work, because I don't want to be a death in the family is already stressful. So you couple it with stress at work. So it will pile up, and it could lead to anxiety or depressions. And I don't want to, I don't want to have anxiety or depression. All right. And let me see. So, another risk factor is personality. There are two personality traits that um, are a huge risk factor for developing anxiety and depression. The first one is neuroticism, or very emotionally sensitive. And then we have introversion. So, a neurotic person is someone who believes that the world is distressing, traumatic, or unsafe. All right. While an introvert person, do not, by the way, do not um, interchange it with shyness. An introvert person or a shy person is not an introvert. Okay. They are two different things. But an introvert person is characterized with having, or he or she enjoys being alone and develop some panic attack when thrown into a large crowd, or you know um, he or she thinks that it would drain their energy. All right. And why do you think these two personality traits are a huge risk factor in developing anxiety and depression? According to a research study, these two personality traits are the ones um, who most likely have negative thoughts. Okay. So, that's why we always say positive thoughts, positive thoughts, positive thoughts, because um, experiencing negative thoughts all the time is not really good um, to your mental health. Then we have genes. Okay. Another risk factor is genes. So, anxiety and depression runs in the blood. If you have a family history of anxiety disorder or depression, then you are prone to getting those mental disorders. And of course, drugs or alcohol. Much worse if you combine the two, drugs and alcohol. It could lead to anxiety and depression. All right. So, moving on, what are the measures to identify anxiety and depression? In the hospital that I worked, we use this, um, we call it HADS, or Hospital Anxiety Depression Scale. This is what our psychiatrist used officially. This is just questionnaires. They, as a psychiatrist, ask the patient series of questions, and they will total they will score it between 0 to 21. So 0 to 7 is normal, 8 to 10 is borderline abnormal, and then 11 to 21 is abnormal. So that's that way that's a measurement they could use to evaluate or diagnose their patient for anxiety or depression. And then I use this one. This is called Face Depression Rating Scale. This is how this is what I use when I assess my patient and evaluate them for anxiety and depression. It is very catchy, and my patients loved them. So they would rate their mood, or their sadness, so to speak, from 0 to 10, with at 10 being the worst. So 0 means no sad, and 10 means freaking sad. All right. And we also have a This one is face um, anxiety rating scale. It also, the patient would rate it from 0 to 10 as well, um, 10 being the worst. So if they rate it a 0, that means it looks good, it's looking good, don't change a thing. But if they rate it a 10, it means that you've enraged the beast. I will hurt you now. So it's that the time you have to run, you run, and you have to call a code gray before you get hurt. All right. So what are the signs and symptoms? Um, the signs and symptoms of anxiety and depression. Actually, anxiety and depression can occur at the same time. Um, they may have each condition may have different causes, but the signs and symptoms and treatment can be done at the same time. All right. And I got this signs and symptoms from Banner Health on their website. And these are actually the common signs between anxiety and depressions. All right. And they also consider this as like a warning signs, like problem with sleep, irritability, difficulty concentrating, loss of appetite, poor hygiene, and of course, feeling sad for days. All right. Now, the management. We have both medical and nursing management. So, as I've said earlier, the anxiety and depression has its own causes, but the treatment can be done both at the same time. All right. In our facility, we use a special treatment plan we call STP, which is tailored for specific diagnosis. And we also have a special behavioral plan, which is tailored for specific behaviors of the patient. But of course, we have other treatments, such as psychotherapy. Psychotherapy is used by the psychologist. They create plan specific for each diagnosis as well. So there is a psychotherapy focus on anxiety and depression. All right. And then, of course, medications, antidepressants are used for both um, anxiety and depression. Um, there are different antidepressants, and the one of them is SSRI. Let's see if I could remember the meaning, what it stands for. So SSRI stands for selective serotonin reuptake inhibitor. Examples of these medications are Lexapro, Prozac, and Zoloft. And excuse me, I'm choking. um, and another group of antidepressants is SNRI, or otherwise known as serotonin norepinephrine reuptake inhibitor. An example of this are Cymbalta and Effexor. All right. And then for nurses, for us nurses, we aside from using therapeutic communication technique, we also do what we call self help. um, in my case, I always encourage my patient to be independent while they are in the psychiatric hospital, so in that way, when they go back to their house or home, they will be able to use their coping skills on their own. All right. Mayo Clinic had some suggestions as well. um, the first one they said is getting organized. Okay, so this one, we need to encourage our patients, or this is actually applicable to us too, those that doesn't have anxiety disorder or depression, but getting organized, like decluttering your physical environment. It will make a lot of difference in our happiness and productivity. And I don't know if you are familiar. I'm sure you are familiar with the Japanese declutter lady, Marie Kondo. All right, her decluttering philosophy has a lot of practical uses. Actually, you declutter your surroundings, your physical surrounding, you declutter your mind as well. Or even simple tasks like your email inbox, for example. If you organize it, it will really make a lot of difference in your life. um, and of course, making new goals as well. If there are things that you wanted to do, or anything that could make you happy, go for it. If you have dreams that you want to achieve, just make a series of goals and try to accomplish it, try to achieve it. Like for me, as I've said, one of my dream is to um, to to become a Zumba instructor. Well, to to be um, maybe be involved in dance fitness. And so I made some goals. One goal leads to another, and there you go. I have achieved a dream of mine. And it actually makes me happy. So, whatever it is, whatever dreams you have in life, as long as it makes you happy, go for it. All right. So, we move to a global health context of anxiety and depressions. This is the third to the last slide. So, there was a, systematic review or a research study done last year, in July 2020, about the um, prevalence of anxiety and depression in the general population of the world. All right, and the results of the study showed the following. So in gender, okay, in gender, they found out that women have increased anxiety and depression during the COVID-19 pandemic. There is an increase anxiety and depression in women than in men. All right. Don't blame me, okay? I'm just don't get mad at me. I'm just a messenger here. So that's what the research study had found out. So yeah, I think it has something to do with the hormones. It's hormonal in nature. And then we have age. And as we have discussed earlier, older adults are the ones that have severe complications when it comes to COVID-19 disease. But I was surprised actually with to find out that on this study, it was the 21 to 40 years old the young adulthood who has an increase in anxiety and depression during or at the start of the COVID-19 pandemic. Why do you think this is? Why do you think this is? The study said that it was because of, remember that the 21 to 40 years are the key active workforce. Okay, so they worry about the future consequences and financial challenges, you know? And then we have education. There was a study in China in August 2020 about the same thing, about the COVID-19 pandemic and in relation to anxiety and depression. And they found out that the higher level of education, or those that have higher level of education, are associated with higher levels of anxiety and depression. Okay, you and me, you guys are on that level. Okay, so we are prone to anxiety and depression. Why do you think this is? Why do you think higher those that who has higher levels of education are have increased anxiety or depression? They found out it's because those with higher levels of education are self-aware. They are self-aware of their own health. All right, and remember, we are in the medical field. Okay, so we kind of know um, a lot of of this one. So w- we are actually prone to anxiety and depression. I'm not kidding. I'm not kidding. We are actually nurses, healthcare providers are prone to anxiety and depression, and of course medical history. And as we have mentioned a while ago, those with chronic illness, okay, like um, lung disease or heart disease or kidney diseases or diabetes, these are the ones who have increased anxiety and depression. All right, I'm almost done. I have two more slides. Then we'll focus on um, the psychological impact brought about by the COVID-19 pandemic in the Philippines. All right, there was a study done last year. Oh, by the way, um, do you know that mental disorder is the third most common disability in the Philippines? Yeah, and that's according to the Department of Health. So, mental disorder is the third most common disability. But anyway, in this study that was done last year, September 2020, they found out that 6 million Filipinos have anxiety and depression. All right, and we that makes us the third highest country in the entire Western Pacific region. The third. Okay. Why do you think this is? Why do you think this is? One of the barriers they found was our help seeking rate. Our help seeking rate is lower even or with as compared to the general population of the US, and even compared to our Asian neighboring countries. or our neighboring countries in Asia. All right. And because we tend to, if we experience symptoms of anxiety and depression, we our go to our family and friends. We don't seek professional help. And I think it has something to do with our attitudes too. Okay, and we will talk about attitudes on this slide. Is It's the nursing implications. So what are the nursing implications of COVID-19 pandemic? And we will focus on um, on the psychological impacts in the Philippines. All right. So as you all know, I am a psychiatric nurse, um, and so I am a proponent of mental health. Mental